Gallup now ranks healthcare affordability as the #1 domestic concern in America. And it has become the place where the system's contradictions are most visible. Families ration medications, they defer care, they make trade-offs that compound greater cost and greater harm down the road. Trust simultaneously erodes, and providers absorb the frustration of a payment model and system they did not design and they cannot unilaterally overhaul. Progress in this area has stalled in part because we've never truly agreed on what we are solving for. Affordability shifts depending on where you sit, and it has long been defined by whoever held the most sustained presence in the room. Providers and purchasers have rarely occupied that room with shared purpose. That is a gap worth closing. And exchanging smear campaigns in the Sunday news, or relabeling decades-old lobbying campaigns alongside a sudden epiphany for affordability, that won't be helpful. The complex, frustrating gap between system expenditure and the outcomes the US population experiences has a name. We at HFMA and Vitalic Health, we call it the affordability paradox. This year, after public comment period, Vitalic launched its first major offering, the US Healthcare Vitals Tracker. The tracker is a comprehensive, transparent framework measuring the system's affordability and its capacity to meet present and future demand. A shared, data-driven foundation for an honest conversation about the system's condition. Beyond a sobering composite score and serious condition rating, the data overwhelmingly exposed a clear trend for the last 25 years. By nearly every measure of medical capability, this system has never been more advanced. We diagnose earlier, treat conditions once considered untreatable, and extend lives in ways unimaginable a generation ago. The science is extraordinary, and it truly deserves our celebration. And yet costs rise, access worsens, the population is not living longer or healthier lives proportional to what we spend. There's no reliable relationship between what we invest in the system and the outcomes we produce. That's the paradox. And the public, they're living inside it. Financial sustainability, now that's where the paradox becomes institutional. The cost of care is structurally complex, and payment models have historically amplified that complexity rather than resolved it. No professional community understands the mechanics of that more precisely than this one. That knowledge, it carries obligation. And HFMA, we do not admire problems.